My name is Charlene Craven. I am a registered nurse, a member of ANA Massachusetts, and I'm testifying in support of H1211 and S747. I have been a practicing nurse for 40 years, with 30 of those years spent in ambulatory care. I currently work for a large provider group in Worcester, and I live and vote in Worcester County. Not only does the nursing compact impact nurses, but it also significantly impacts patients, potentially every person who resides and seeks health care within Massachusetts. I thank you for the opportunity to tell you a little bit about how patients and nurses are impacted every day by not being in the Enhanced Nurse Licensure Compact. As you may imagine, I've seen a lot of changes in healthcare delivery over 40 years. COVID was a significant driver in delivery changes, but changes were occurring even before then. When I first began employment with my organization, charts were paper records and patients came in to be seen with occasional problems handled over the phone. Today, patients fully expect to receive their health care where and when they need it, whether that is in person, over the phone, via patient portal, or via video visits. Our nursing law has not kept pace with technological advances. I am licensed to practice in Massachusetts, and my patients must seek care in Massachusetts. I am currently not licensed to deliver care outside of Massachusetts. What that means is if my patient lives in a border state, goes to school outside of Massachusetts, or vacations somewhere else and seeks care from my organization, our options are limited on what we can legally do. I can offer the patient a visit to the emergency department or potentially an urgent care facility. I cannot offer advice on how to even treat a minor complaint. Imagine the college student with a sudden illness who seeks our care. I have to refer that student to a facility where they are unknown and where they may feel very uncomfortable and unsupported. Or the elderly patient vacationing in Florida who calls with a familiar complaint, who wants care from someone they know and knows them. We are unable to help that person when they may be in a vulnerable state. Continuity of care is disrupted, and the cost of care is very often significantly higher. Patient satisfaction is also affected. On a personal note, I was hospitalized for 5 days during July 2021. This was during the height of COVID and during the protracted nurses' strike at a particular hospital. Frankly, I expected subpar care. Every single nurse that cared for me was from out of state. I couldn't ask for better, more professional care than what I received during that stay. Becoming part of the Enhanced Nurse Licensure Compact would allow nurses working in ambulatory care to provide comfort to our patients in any state that recognizes the compact. This potentially improves patient satisfaction, patient outcomes, cost of care, and nursing satisfaction. I strongly support passage of this long overdue act and urge you to do the same. Thank you.
Thank you. Charlene? Rosemary, I'm sorry.
Thank you. Good morning, Chair Friedman, Chair Long, and all the members of the Joint Committee on Healthcare Financing. I am speaking on behalf of the American Nurses Association of Massachusetts, of which I am a member, in support of H1211 S747. I want to thank you for the time to explain to you why I support the Nurse Compact. My name is Rosemary Mortimer, and we own a home in North Falmouth. I was born and raised in Dorchester and graduated from Boston University with a bachelor's degree in nursing 50 years ago this May. Toward the end of my time at BU, I opted to join the United States Army. My career in the active duty military was only 3 years, but I met and married a career military man, and we were eventually transferred and subsequently retired in Maryland. But I have never forgotten my Massachusetts roots, and my students used to say my accent. We have owned property on Cape Cod since 1984. Early on in my career, I held a Massachusetts nursing license as well as licenses in 3 other states due to schooling, work, and being transferred by the military. Having nursing licenses in multiple states where we were no longer living or working seemed ludicrous as well as expensive. So I kept my Maryland one while letting all the others, including Massachusetts, lapse. In January of 2021, I became a member of the Barnstable County COVID Healthline for a year and a half and was able to use my health knowledge remotely wherever I was for the benefit of people on Cape Cod who are trying to find places to access vaccines. I believe this helpline was originally Senator Sears' idea, and I would like to publicly thank him on behalf of the people of Barnstable County for whom this line was a literal lifesaver, as well as on behalf of my many professional colleagues who worked on the line. A number of us who worked the line were discouraged due to either our age and/or disabilities of working clinically, yet we wanted to use our expertise to assist our community during this terrible time. I have worked both clinically and as a faculty member in nursing for almost all of the past 50 years, retiring eventually from the Johns Hopkins University School of Nursing. I was on faculty there for over 26 years and taught literally thousands of students how to give clinical care, including how to give injections. In the spring of 2021, vaccines were becoming more available, and the Cape Cod Medical Reserve Corps was looking for licensed volunteers to work clinics. I volunteered to assist. Fortunately, President Biden had authorized healthcare workers to work across state lines in this emergency. Without this authorization, I would have been limited to participate only in the role of traffic control, which of course would have been a tremendous waste of my expertise and it is a service to the citizens of Massachusetts. If Massachusetts was a compact state, there would have been no questions if my unencumbered Maryland license was valid and I would have been able to assist immediately. I have passed several background checks. And on a personal note, giving COVID vaccines was one of the highlights of my nursing career. Lastly, I was a member of the Maryland Nurses Association Legislation Committee in 2000, when Maryland became the first state to sign on to the Nursing Compact. This has become extremely successful in Maryland for the past 23 years. Having the ability to work across state lines has been a tremendous benefit to nurses, healthcare facilities, and patients. Having the compact nursing license has led to no problems of which I am aware. Thank you for listening, and I urge you to help to pass H 1211 and S 747. I am happy to answer any questions. Thank you.
Thank you very much, and you still have your accent, so.
Yes, ma'am. And I still root for my Red Sox. Thank you.
Are there any questions? No, thank you very much. Thanks for testifying. Rep. Cod.
Thank you.
Oh, we're just hearing about your bill.
Thanks very much. Chair Friedman and Chair Long, thanks for taking me out of turn, and the committee. So I'm really thankful for the opportunity to address you today and advocate for the advancement of a more accessible, robust healthcare system in the Commonwealth. And I'm talking about H 1211, an act relative to nurse licensure compact in Massachusetts. I've been filing this for many years, so hopefully this will be a time that we can move it forward. But just to say, drawing from my extensive experience as an advanced practice nurse, psychiatric nurse, I've gained unique insights into the daily challenges of our dedicated nurse workforce. In particular, the nursing shortage in Massachusetts demands immediate attention. Each day, our nurses find themselves on the front lines, battling not only to provide quality care, but also to cope with the ever-increasing burdens that this shortage has placed on us. Burnout and stress have become all too common in the nursing profession. Our reliance on temporary staff has disrupted the continuity of care, leaving both our healthcare workforce and our patients vulnerable. The consequences are very troubling. A decrease in healthcare workforce supply, a decline in the quality of care, and the grim reality of avoidable emergency department visits. And then there's the financial toll. Desperate to bridge the gaps in our healthcare workforce, hospitals have turned to costly contract labor, putting tremendous strain on our employed nurses, and in turn driving up the already exorbitant costs of healthcare in our state. We're not just talking about statistics and numbers, we're talking about lives affected and potentially lost. We're talking about a strain on our healthcare system that extends well beyond our nurses and reaches into the very fabric of our communities. This bill, which would make Massachusetts a member of the National Licensure Compact, or NLC, is a crucial vehicle for nurses to practice across straight lines without the burden of juggling multiple single state licenses. Membership in the NLC is incredibly beneficial for nurses, allowing for flexibility and financial relief. By embracing the NLC, we open the doors to a more dynamic and mobile nursing workforce, simultaneously fostering opportunities for career diversification, including the promising field of telehealth, and facilitating the important work of nurse educators. Above all, being a member of the NLC secures great access to care for patients, particularly in underserved regions. H1211 is not just a piece of legislation, it's a lifeline for our healthcare system and the people it serves. We have a moral obligation. I don't know if people can hear me. Okay. We have a moral obligation as legislators to address this pressing issue. It's a time to ensure a brighter, healthier future for our Commonwealth and to stand by those who tirelessly care for us. So thank you for your time and consideration. And I would also just add that we have so many people coming from other states, even states that are, neighboring states from across the country for healthcare in Massachusetts. And when they get the care here, the nurses that are caring for them can't communicate with them when they leave. So that really is another burden, I feel. And we have, I think, a significant number of folks coming from out of town, particularly for cancer research and specialties and all kinds of specialties, actually, because we're kind of a known place, in the Boston area. So thank you very much for the time and for taking me out of turn.
Thank you.